All right, hi, this is Jennifer Leslie performing task 16. We're going to be applying a modified Robert Jones bandage. I have my tray of supplies here. We have our vet wrap tape to create our stirrups and then pre-measured stirrups. They are going to be hanging off of the paw about 5 inches. We have tongue depressors to make sure that those stirrups, the tape's not sticking to itself. Conforming stretch gauze, and then cast padding as well, and then a non-adherent bandage if needed. Our patient does not have a wound, but if she were to have a wound, we would need to make sure that we clipped, cleaned, and then dried that wound, applied any medication that was necessary, and then put on the non-adherent bandage prior to putting on the other layers of her bandage. So that's all of our tray of supplies, and we're going to go ahead and get our patient Bonnie up on the table. So my assistants are going to go ahead and do that for us. Good girl, Bonnie. Whoop. Girl. All right, and then we are going to be applying this bandage to the forelimb. Make sure that we stretch that out as needed, and I'm going to apply those stirrups first. Go girl. All right, and so we do have that about 5 inches hanging from that paw, and it is over that wrist joint as well. When I apply, I'm going to make sure that they're smooth and no wrinkles in there. Now, if there was a wound, I would want to avoid that wound, but there's not, so the stirrups just need to be parallel to each other. So that way, again, they're going to assist in making sure that the bandage is not slipping. And then we've got the tongue depressor there. And the other one. All right. So I'm going to start with that first layer of cast padding. And I'm going to make sure that her 2 digits are hanging out, so I'll still have some digits visible. As I'm applying the bandage, I am going to make sure that it is tight, but not too tight, because I don't want to constrict the animal. And then I am going to also make sure that as I'm moving up proximal to her leg, I'm going to start at that distal portion, I am going to make sure that I am overlaying the bandage just about 50%. And then I can use my thumb to ensure that it is tight, but not too tight. And again, I want to make sure that it is straight and not crinkling or layering over itself. Okay, and again, we are at a 50% overlay as I'm wrapping that. And I'm kind of stretching and letting it go back in on itself so it doesn't constrict too much. Okay. And then that's just about 50% overlap, making sure it's nice and straight. I'm going to go up over the elbow. All right, so I'm over the elbow. I'm going to go ahead and use these bandage scissors. And then I am just going to check the toes before I apply that second layer of the cast padding. So there's no swelling, the temperature is good, not cold. And then I can get my finger underneath on both the proximal and distal end. So I'm going to go ahead and apply that second layer of cast padding. Making sure it's nice and straight, or smooth rather, and then again, 50% overlap as I go from the distal to proximal aspect of the leg. smooth, and again over that elbow. So we can go ahead and cut. And then when we apply that conforming layer, that will be able to stay in place. I'm going to make sure again with my fingers, I can get my fingers in that top, also at the bottom. Good girl, I know, Bonnie. And then just checking her toes, we still have good temperature there and no swelling. So I'm going to go ahead and apply the conforming gauze, again starting distally and wrapping nice and straight with a 50% overlap. So I am over that elbow, then making sure that there's no creases. And I'm going to make sure that that last layer is in place. Okay. And that is straight and smooth and everything is in place there. And again, check, it's not too tight, but it is still conforming to the limb. Check distally. I can get my finger in there so it's not too tight again. And then just that final check on her toes. Good girl, I know. So I still have a good temperature and they're not swollen. So now I'm gonna go ahead and adhere my stirrups before I do the vet wrap. I'm just gonna twist. Okay. And straight up. And then do the same. So twist. And apply straight. Make sure again that it is nice and smooth. Okay. Now I'm going to go ahead and start with that vet wrap. As I unravel the vet wrap, I am going to kind of stretch it out and let it come back in on itself to make sure it's not too constrictive. And I am also going to make sure I leave a little bit of that cast padding at the bottom so it's comfortable for her. So there is still cast padding visible at the bottom of the bandage. And as I wrap, I'm going to again stay consistent with that 50% overlay and making sure that it's not crinkling on itself. And I can use my thumb to ensure that it's not too tight. And I still have a 50%. course, that everything is still nice and smooth. And that I still have a 50% wrap. Or overlap rather. And I am gonna cut that, so I'm over that elbow, but I wanna make sure that I still have some of that cast padding at the top exposed, so that way it's more comfortable. Okay, so that layer's been applied. Hold on, baby girl. And then I'm gonna again check, it's not too tight at the top, at the distal limb. Good girl. Get my fingers in. I can also feel that there's no swelling and her temperature is still normal in her toes. So I've still got good temp in her toes, also no swelling. We can see that the bandage is at the 50% wrapped and that it's nice and smooth on her as well. So that is how we properly apply the modified Robert Jones bandage.